Hello, we are live with Fertility Empowerment Show. It's been some time. We haven't had any show in fertility. We only had like green healing show, but today, because we are honoring June month, so I invited Jessica Ritch, Dr. Jessica Ritch, to be here. We're going to talk about fibroids and endometriosis. If you have any question and you are struggling with fertility, please join us and ask questions. Be with us till the end. Very welcome to my show, Jessica.
Thank you. I'm so happy to be here. Thanks for having me.
Yeah. So this month, as you know, we more talk about fertility, and I know a lot of females have this problem of thyroids and endometriosis. Is that, first of all, I want you to talk about yourself, about your background, why were you interested to be a MD, medical doctor, and after that, gynecologist.
All right. Well, thank you again for having me. So, I am a minimally invasive gynecologist, which means that I went through the sort of whole process of becoming a medical doctor. I went to undergraduate and medical school in the US. And then I really liked taking care of women in general. I like that interaction with women patients and a lot of the issues that we address. And of course, going through a lot of those issues myself. That's why I chose obstetrics and gynecology. And then when I was going through that 4-year residency program, I found that I was really drawn to the gynecology side of things. While it was fun to deliver babies and do that sort of thing, I really liked helping women kind of either get to that point or deal with the issues that were often ignored. So things like pain and abnormal bleeding and incontinence and a lot of those issues that we kind of say, oh well, that's just part of being a woman, and we ignore them. So I really liked that, and I really liked the surgical side of things. So that's why I decided to do a fellowship in minimally invasive gynecology, where I could get more in-depth training, focusing on those issues and the surgical and medical and physical therapy and other types of treatments that we do to solve those issues.
So, Jessica, you said you had problem as well. So that's
Mm-hmm.
why, because I'm doing the fertility coaching as well. So,
Mm-hmm.
because I had problem with my own fertility, that's why after I resolved it, I said, oh, it's a good idea to help others because we're going to share this message to women who are struggling and they think that there is no hope to get pregnant.
Mm-hmm.
So tell me
Mm-hmm.
about your story. What was your problem?
Yeah, so initially delayed my trying to get pregnant until a little bit later in life, not too late. I was about 32 when I first tried to get pregnant. And that was because of the training that I was doing. But when I was trying to get pregnant initially, I had really heavy, horrible periods, like kind of staining through my clothes, really, really bad periods. And I found out that I had what's called a submucosal fibroid. So a fibroid that's kind of pushing into the inside of the cavity of the uterus. So I did end up having a procedure to resect or remove that fibroid first, because I found that I couldn't even really tolerate my periods enough to try to get pregnant at that point. So I did have that procedure to remove it, and then my periods normalized, and I was able to get pregnant at that point after removing the fibroid. And I do have 3 children now.
Oh, good for you.
Mhm.
So some of these fibroids, as you say, are not really important, right?
Mhm.
Are not blocking the path of fertility. What are
Mhm.
those that are should be removed, and some of them cannot be removed, right? Can you talk about all of them?
Right, right. So first of all, fibroids are really common. It's one of the most common problems that we have as women. It's like 60 to 80% of women have fibroids. And fibroids are not always an issue. You're absolutely right. So if somebody has fibroids, but they're not having any symptoms from it, it's not causing any issues to their fertility, then we don't have to do anything about them. But whether or not they cause symptoms and whether or not they're impacting fertility really depends on the size and the location of the fibroids. And particularly the fibroids that are most impactful are those what we call submucosal fibroids, or fibroids that kind of push into the inside of the uterus. Because not only can they cause a lot of heavy bleeding, like what I had, but they can also cause difficulty in implantation, so that you can't have proper implantation in the uterus. And that usually either results in trouble getting pregnant in the first place or early miscarriage. So that can really be an issue, even if the fibroid is kind of small. If it's in that location, it can be bothersome. Now, other fibroids live in the muscle of the uterus or live on the outside of the uterus. And those really don't tend to have a huge impact on fertility unless they're getting very large or in an area where they're blocking or distorting the fallopian tube. And there's, pretty easy tests that we can do to evaluate for that, either ultrasound to kind of see the size and the location of the fibroids, or something called a hysterosalpingogram, where we put a little bit of like dye inside the uterus and look and see if the tubes are open or if they're blocked by one of those areas. So in those cases, if there is blockage, then we would recommend removal of the fibroids. But if not, it's really just more of a discussion about what the symptoms are for the fibroids, whether or not to remove them prior to a pregnancy or whether to go ahead and get pregnant with the fibroids in place.
So it's completely possible to get pregnant even if you have fibroids and even if they are blocking the fertility because you can remove it with surgery.
Exactly,
Yeah.
exactly. So surgical removal is a great option for women who are having symptoms from the fibroids or difficulty. If it's something like the submucosal fibroid, like I had, it's a really easy procedure where we go in with a camera device in through the vagina and through the cervix, and we kind of use, it's almost like a little Pac-Man to kind of like shave out and suction up the fibroid. That procedure typically takes less than an hour. And then afterwards, you have just like a little bit of cramping and spotting. I was like walking around New York City the day after my procedure with no problem. So the recovery time is pretty minimal. There's very little incisions, and you can try to get pregnant even the next month after having that procedure. If there's those bigger fibroids that are either in the muscle or on the outside that are blocking the tube, then that requires a little bit bigger of a procedure that does go in through the abdomen with incisions. But even that, the typical recovery time is, usually anywhere between 2 to 6 weeks, depending on how the procedure is done. And then most women can try to get pregnant within 3 to 6 months of that procedure.
Great. So do you suggest any diet for treating fibroids, or let's say I know when you have fibroids you are very worried, you think, oh, maybe I have to change my diet, because even if it's not blocking um, the path of fertility, still
Mhm.
there might be issues because still you get heavy periods, right? So
Mhm.
do you recommend any diet?
Yeah, unfortunately, there's not a whole lot of evidence that significant changes in the diet will make a big impact on the fibroids, either their growth or their symptoms. There's of course a lot of different supplements out there that some women find helpful, but again, not a whole lot of data to support one over the other. There's some information out there on things like dairy and on meats and how they may affect the fibroids, but again, it's very limited evidence. Most of the time, women who have fibroids have heavy periods. So, of course, having a lot of iron in the diet can help to support that. But there's nothing really in the diet that's going to shrink or get rid of these fibroids, unfortunately.
Got it. What about endometriosis? So
Mhm.
first, I know some of my audience want to know about endometriosis. Can you describe endometriosis and how we can see the symptoms and how to treat it?
Sure. So endometriosis is also very common. It's not quite as common as fibroids in terms of how common it is in the general population. It's about 10% of women who have that, but it has a big impact on fertility. So about 50% of women with endometriosis will have issues with fertility. And actually, for women who have infertility, endometriosis can be the problem in up to 50% of those women too. So what it is, it's a condition where the glandular tissue that's kind of like the lining of the uterus, when similar tissue grows in places outside of where it's supposed to. And that can be within the muscle of the uterus, or it can be around the ovaries or other places in the pelvis. It can actually be found anywhere in the body, but we tend to see it most often in the pelvis, and that's where it tends to affect fertility the most. In addition to sort of having those glandular cells, there's an inflammatory process. So it causes a lot of inflammation in the pelvis, which can cause pain and infertility. It can also cause scar tissue that can distort the fallopian tubes and distort a lot of the tissue around the uterus and the ovaries as well. So it can become quite an issue.
What's the difference between endometriosis and fibroids?
So fibroids are basically a growth in the muscle of the uterus, and that typically happens. It's one abnormal cell in the muscle that starts to grow abnormally and cause that fibroid in the smooth muscle. And then typically when we remove the fibroid, yes, you can have more fibroids that come back, but that particular fibroid won't recur. Endometriosis is a little bit different, and to be honest, we don't know exactly what causes endometriosis in the first place. There's a lot of theories out there, but none of them are really quite the perfect theory. But we know that somehow those cells that are like that lining get into places where they're not supposed to and cause this inflammatory and neurologic response. So that even if there's like a tiny bit of endometriosis behind the uterus or in another place of the pelvis, that inflammation can still affect fertility. And definitely if there's endometriosis around the ovaries, that can play a role in fertility as well.
So how can you treat it?
Right. So there are a couple of different ways we treat endometriosis. The diagnosis is actually a little bit more difficult than with fibroids. With fibroids, we can do an ultrasound. We know if there's a fibroid there, we have a good idea of the location. With endometriosis, sometimes we can see it on ultrasound if there is a cyst on the ovary. That's something we call an endometrioma. Or if there's endometriosis type tissue within the muscle, there are some things that suggest that. But if there's not, there may be a completely normal ultrasound and a woman can still have endometriosis. So the only way to really diagnose it with certainty is to do a surgery, basically a laparoscopy, where we make a small incision in the belly button, usually 1 to 2 on each side, and look for and treat the endometriosis. This is really the best option for both diagnosis and treatment for women who are trying to get pregnant, because not only do we know, okay, is the endometriosis the issue, but then we can treat it by resecting or removing any of the endometriosis that we find, by breaking up scar tissue, by evaluating how patent the fallopian tubes are. So it's really the best form of treatment for women who are trying to get pregnant. And typically the best time to get pregnant if you have endometriosis is shortly after you've had a surgery. I actually just got a message. It was so nice to hear from one of my patients who I had treated with surgery about 4 years ago. And I had recommended to her and her husband that it would be a good time to try to get pregnant after we did their surgery. And she just messaged me the other day to tell me that that it was her child's birthday, and she wanted to just say thank you, that she never thought she could be a parent with the endometriosis. So definitely surgery can make a difference. There are other treatments for endometriosis. Most of those are hormonal treatments, so it's going to be difficult to get pregnant while you're on those treatments. Those are really to help the symptoms when you're trying not to get pregnant. And then there are some herbal supplements that can help to sort of manage the symptoms along the way, but there's really not a lot of data on whether or not those help with fertility.
Mm-hmm. Thank you so much. So what do you have on your website? Florida AURO gene.
Yes,
Yeah.
yes. I work for the Florida Center for Urogynecology. So we do a combination of the minimally invasive gynecology type stuff that I do, and then my partner is a urogynecologist. So she specializes more in things like incontinence and prolapse. But if you do go to our website, you'll find information about these issues that we talked about the fibroids, about endometriosis. We have some links to videos that we have on our YouTube channel, which is the same name, Florida Center for Urogynecology, which talks about all of these issues and the different treatment options that are available.
Okay, thank you so much. And do you have any recommendation for women who are getting pregnant, who wants to get pregnant, who and can't. Any hopeful message? Anything?
Right. So, of course, this is one of the sort of most frustrating times for many women. And it's one of those times where, you know, there's a lot of people around you who have a lot to say, and some of it is helpful and some of it is not helpful. I really think it's a time that you kind of have to surround yourself with people who are supportive, and then find a physician who's going to listen to you and what your goals are. Because even for women who have bad fibroids, even for women who have bad endometriosis, even for women with other conditions, it doesn't mean that all hope is lost. While these things can make it more difficult to get pregnant and can reduce the chances of pregnancy, there's almost always something that we can do to improve those chances and to help you to reach your goals. So, whether it's a minimally invasive gynecologist or a reproductive endocrinologist, an infertility specialist, there are a lot of things that we can do to evaluate and treat your issues and get you towards your goals.
You actually refer to a good point for the support and
Hmm.
support group or supporting people, because in that position when you are struggling and you really need some people around you who really support you, because
Hmm.
I feel that even with gynecologists or fertility expert, you need to have a connection. Right. So
Hmm.
sometimes this connection is not really happening, then you have to switch. I believe in it because I was in the same shoe. And then I went to fertility um, clinic, and
Hmm.
because I was over 40, she was not really hopeful. So from the beginning, I didn't get the good wave. So
Hmm.
I was like, oh my goodness, what's happening to me? That's why as soon as I left the clinic, and I just follow some acupuncture and other holistic medicine, then I got
Hmm.
pregnant. I think uh, it's so important. First, you go and check your body if you need a surgery, if there is something for
Hmm.
your hormones should be adjusted, then you definitely need your doctor, and try to take care of yourself as well, because even if you go to doctor and you don't go, uh, there is no self-care, of course doctor cannot help you, right?
Exactly. I agree with you 100%. So, first, I agree that you really have to have a strong connection with your doctor. These are really difficult things that women are dealing with, and they're very intimate. They can be a source of pain and frustration and embarrassment, but also a lot of hope and joy. And so it's really important that you connect with the doctor. And just like any other relationship, not every doctor is going to be perfect for every patient and vice versa. So if you don't find the right person on the first try, it doesn't necessarily mean that that person's not a good doctor. It just means they're not the right doctor for you. So, keep trying until you find somebody that really kind of understands what you're going through and can give you that hope, because that's the other thing you mentioned. So definitely stress plays a huge role in our fertility. I know it's hard when we want to get pregnant not to get stressed about it. I've dealt with that myself, and you've always got like a mother-in-law or somebody who's like, when are you pregnant, when are you getting pregnant, which isn't helpful in any way. So whatever you can do to reduce that stress, I do think things like acupuncture can make a huge difference. And I've had a lot of my patients who had improvements in their fertility and were able to get pregnant with acupuncture. And how much of that is related to that stress response or related to other factors, I don't know, but I think it can be helpful. And I know we talked about diet earlier and how it's not really going to necessarily cure things like endometriosis or fibroids, but definitely if you're having, a healthy diet, putting the right things into your body, avoiding a lot of inflammatory foods, then that's just going to help your body to function better in general. If you're constantly under stress, your body's going to, divert its energy away from things like reproduction, which are not kind of emergency things. So the more good fuel you put into your body, the less stress you put, the more your chances are at getting pregnant.
Thank you so much, Jessica, for being here. Hopefully this month, June, It's a productive month for many people who are trying to get pregnant, and we wish
Mhm.
you all the best. So try to first go and check your body with your fertility doctor if you need any surgery, and apart from it, have a support group, which is really important. And then third one, please take care of yourself, reduce your stress, and maybe now is summer, you can have a walk in the nature, go somewhere that you like, do something that you want, and
Mhm.
that really help you to be more productive.
Definitely.
Uh, Thank you so much. I wish to have you more and more here.
I'm happy to be here anytime. This has been fun.
Yeah. Please subscribe to Panta Calhoun Transition channel and order my book Naturally Conceive through Amazon. Thank you for watching.